swelling after fillers. What's normal and what can we do about it? When you have fillers injected, you're having a hyaluronic acid gel injected beneath the skin. There are two reasons why swelling can happen. One is that the hyaluronic acid in the filler attracts water, and so that can lead to some swelling. But also, you've had a procedure where you've had needles involved and some tissue trauma, and that in its own right promotes some inflammation. I always tell people to expect to swell, but the degree to which they're going to swell will vary between individuals and also vary between areas. So for example, when it comes to treating the lips, if you think about when you bite the inside of your lip accidentally, how quickly that swells up, and so often you end up biting it again and again because it's swollen and it gets trapped between your teeth. If you think about that, you understand why swelling in the lips tends to be most significant after filler. I will always warn my patients to expect 24 to 48 hours where the swelling can be quite dramatic. And that's an important thing for us to manage as practitioners as well, because you can look in the mirror and you can think, oh my God, I've gone way too far, I've had far too much, but things do settle down and it doesn't take that long. But I would rather that you were aware of this, and so then you can plan your life. You make sure you don't have anything really important happening later that day or the next day, so you're not self-conscious about it. When it comes to other areas, the swelling varies. You will certainly feel it. So I always describe that when you touch an area that's been treated, you'll feel the filler there for a little while, and you'll also feel potentially slightly tender. Not usually significantly, not usually painkiller territory. But when we get towards treating chins and jawlines, this is quite a tight space. This can be much more uncomfortable, and so that may be an area where people do decide they'd like to take some painkillers. So it's important to understand why different areas can feel different. When it comes to what you can do about it, we, or I as a practitioner, will always try and make the procedure as minimally traumatic as possible so that hopefully swelling is as little as possible. But there will be times that something happens. You can do several things about it. First is patience. Second is using things like arnica or ice to help to soothe and calm things down. If someone has very severe swelling, we could think about using some steroids, and that can calm it down very, very quickly. Ibuprofen or anti-inflammatories are another good option. The offset is that that could make bruising worse, so it's important to balance. I can usually tell if you're going to bruise badly immediately after a procedure, and if you're not, it may be that you think actually it's worth me taking a couple of anti-inflammatories. Antihistamines can also be an excellent option, and this is something anyone who's worried about swelling, I will advise them to use some antihistamines peri-procedure to help minimize the swelling. So it's one of those things that, provided you understand it and you plan your life to mitigate for it, it's not that big a deal, but it's important that you do know what to expect. If this content has been useful for you, please give it a thumbs up or send me a little message below, and please do subscribe if you'd like to see more content like this.